Question 1. A 68-year-old patient arrives in the emergency department reporting crushing chest pain radiating to their left arm, diaphoresis, and shortness of breath. The ECG shows ST segment elevation in leads V2-V4. Which initial nursing intervention is the highest priority for this patient? A. Administering a prescribed anxiolytic to calm the patient. B. Obtaining a detailed medical history from the patient's family. C. Preparing the patient for immediate cardiac catheterization. D. Administering oxygen via nasal cannula at 2 liters per minute. Answer: C. Preparing the patient for immediate cardiac catheterization. This question tests your understanding of the immediate priorities for a patient experiencing an ST elevation myocardial infarction, STEMI. The key clues are crushing chest pain, ST segment elevation, and highest priority, indicating an acute cardiac event requiring rapid intervention. For STEMI, immediate reperfusion therapy, typically through percutaneous coronary intervention, PCI, via cardiac catheterization, is crucial to restore blood flow to the ischemic myocardium and minimize cardiac muscle damage. While oxygen and comfort measures are important, timely reperfusion saves heart muscle, making it the top priority for improving outcomes. Remember, time is muscle in a STEMI, so expediting reperfusion is paramount. Question 2. A nurse is caring for a patient post-myocardial infarction who is experiencing premature ventricular contractions, PVCs, frequently. The patient's blood pressure is stable, and they deny chest pain. What is the most appropriate initial nursing action? A. Administer a bolus of intravenous lidocaine. B. Prepare for immediate cardioversion. C. Assess the patient's electrolyte levels, especially potassium and magnesium. D. Increase the rate of the intravenous normal saline infusion. Answer: C. Assess the patient's electrolyte levels, especially potassium and magnesium. This question addresses common post-MI arrhythmias and their underlying causes, specifically focusing on PVCs. The crucial information is that the patient is hemodynamically stable, blood pressure is stable, and they deny chest pain, which suggests that the PVCs are not immediately life-threatening and warrant investigation into their cause. Electrolyte imbalances, particularly hypokalemia, low potassium, and hypomagnesemia, low magnesium, are common triggers for ventricular ectopy after an MI. Addressing these imbalances is often the first line and most effective treatment. Always consider reversible causes like electrolyte disturbances before escalating to antiarrhythmics or cardioversion in a stable patient. Question 3. A patient admitted with an acute inferior wall myocardial infarction suddenly develops bradycardia, heart rate 40 bpm, and hypotension, BP 80/50 mm of mercury. The nurse should anticipate administering which medication first? A. Dopamine. B. Atropine. C. Amiodarone. D. Adenosine. Answer: B. Atropine. This question evaluates your knowledge of managing hemodynamically unstable bradycardia, particularly in the context of an inferior wall MI. Inferior MIs often involve the right coronary artery, which supplies the AV node, leading to sinus bradycardia or AV blocks. The keywords bradycardia and hypotension indicate an unstable rhythm requiring immediate intervention. Atropine is the first-line medication for symptomatic bradycardia because it blocks vagal stimulation, increasing heart rate and improving cardiac output. Administering atropine helps to quickly restore a more stable heart rate and blood pressure, which is critical for preventing further complications. Question 4. A nurse is reviewing the laboratory results of a patient admitted with chest pain. Which cardiac biomarker is most specific for myocardial damage and remains elevated for the longest duration? A. Myoglobin. B. Creatine kinase MB, CKMB. C. Troponin I. D. Aspartate aminotransferase, AST. Answer, C. Troponin I. This question tests your understanding of cardiac biomarkers used in diagnosing myocardial infarction. The key phrase, most specific for myocardial damage and remains elevated for the longest duration, points directly to troponin. Troponins, INT, are highly specific to cardiac muscle and are released into the bloodstream when myocardial injury occurs. Unlike myoglobin, which rises quickly but isn't specific, or CKMB, which also rises but normalizes faster, troponin levels remain elevated for up to 10 to 14 days, making them excellent for diagnosing both early and late presentations of MI. Remember, troponins are the gold standard for detecting myocardial necrosis. Question 5. A patient post-anterior wall myocardial infarction develops sudden onset of severe dyspnea, crackles throughout lung fields, and S3 heart sound. The nurse suspects the patient is experiencing which complication? A. Pericarditis. B. Cardiogenic shock. C. Ventricular septal rupture. D. Right ventricular failure. Answer, B. Cardiogenic shock. This question focuses on recognizing signs and symptoms of a serious complication post-MI. The keywords sudden onset of severe dyspnea, crackles throughout lung fields, and S3 heart sound in a patient with an anterior wall MI are classic indicators of acute heart failure with pulmonary congestion, often progressing to cardiogenic shock if severe. Anterior MIs affect the left ventricle, leading to impaired pumping ability and decreased cardiac output, which then causes blood to back up into the lungs. Early recognition and aggressive management of cardiogenic shock are vital for patient survival. Question 6. A patient is prescribed sublingual nitroglycerin for chest pain. The nurse should instruct the patient to call emergency medical services, EMS, if the chest pain is not relieved after how many doses? A. 1 dose. B. 2 doses. C. 3 doses. D. 4 doses. Answer, C. 3 doses. This question assesses knowledge of safe and effective use of sublingual nitroglycerin for acute chest pain. The standard protocol for nitroglycerin administration is to take 1 dose every 5 minutes, up to a maximum of 3 doses. If chest pain persists after the 3rd dose, it suggests that the pain is likely not stable angina and could indicate an acute myocardial infarction, warranting immediate medical attention. Calling EMS after the 3rd dose ensures prompt evaluation and treatment, as delaying care for an MI can lead to greater cardiac damage. Always emphasize this crucial 3-dose rule to your patients. Question 7. A nurse is educating a patient post-MI about lifestyle modifications. Which dietary recommendation is most appropriate to reduce the risk of future cardiac events? A. Increase intake of red meats and full-fat dairy products. B. Limit consumption of fruits, vegetables, and whole grains. C. Choose lean protein sources, reduce saturated and trans fats, and increase fiber. D. Focus on a high-sodium, low-potassium diet. Answer, C. Choose lean protein sources, reduce saturated and trans fats, and increase fiber. This question targets essential patient education regarding secondary prevention after a myocardial infarction. The core concept is adopting a heart-healthy diet to manage risk factors like hyperlipidemia and hypertension. choosing lean proteins, significantly reducing saturated and trans fats, found in many processed foods and animal products, and increasing fiber, found in fruits, vegetables, and whole grains, are all evidence-based recommendations for cardiovascular health. This dietary pattern helps lower cholesterol, manage blood pressure, and maintain a healthy weight, thereby decreasing the likelihood of future cardiac events. Educating patients on these specific dietary changes empowers them to take control of their heart health. Question 8. A patient is admitted with a suspected NSTEMI. Which ECG finding would be consistent with this diagnosis? A. ST segment elevation. B. Pathological Q waves. C. ST segment depression or T wave inversion. D. Ventricular fibrillation. Answer: C. ST segment depression or T wave inversion. This question tests the ability to differentiate ECG findings between STEMI and NSTEMI, non-ST elevation myocardial infarction. For NSTEMI, the characteristic ECG changes include ST segment depression or T wave inversion, indicating myocardial ischemia without full-thickness damage. In contrast, ST segment elevation signifies a STEMI, which involves full-thickness myocardial injury. Understanding these distinct ECG patterns is crucial for guiding initial treatment strategies and determining the urgency of reperfusion therapies. Remember, STEMI still represents an acute coronary syndrome, just without the complete coronary artery occlusion seen in STEMI. Question 9. A patient recovering from an acute myocardial infarction is prescribed a beta blocker. The nurse understands that the primary benefit of beta blockers in post-MI patients is to A. Increase heart rate and myocardial contractility. B. Reduce preload and afterload. C. Decrease myocardial oxygen demand and prevent remodeling. D. Dilate coronary arteries and improve blood flow. Answer: C. Decrease myocardial oxygen demand and prevent remodeling. This question assesses knowledge of the pharmacological management of post-MI patients, specifically the mechanism of action and benefits of beta blockers. Beta blockers work by blocking the effects of adrenaline on the heart, which leads to a decrease in heart rate, blood pressure, and myocardial contractility. This reduction in the heart's workload directly translates to a decreased myocardial oxygen demand, helping to prevent further ischemia and protect damaged cardiac tissue. Additionally, beta blockers can help prevent adverse cardiac remodeling, changes in heart shape and function that can occur after an MI, improving long-term outcomes. Question 10. A nurse is preparing a patient for discharge after an acute MI. The patient asks, "When can I resume sexual activity?" What is the most appropriate response? A. You should avoid sexual activity indefinitely. B. You can resume sexual activity as soon as you feel ready, usually within 1 to 2 weeks. C. Sexual activity is similar to walking up 2 flights of stairs or briskly walking a mile without symptoms. Discuss with your doctor at your follow-up. D. You should wait at least 6 months before considering sexual activity. Answer: C. Sexual activity is similar to walking up 2 flights of stairs or briskly walking a mile without symptoms. Discuss with your doctor at your follow-up. This question addresses an important, often overlooked, aspect of patient education after an MI, resuming normal activities, including sexual activity. The key is to provide a realistic and reassuring guideline while emphasizing shared decision-making with their healthcare provider. Sexual activity can typically be resumed when the patient can perform activities equivalent to moderate exercise, such as climbing 2 flights of stairs or walking briskly for a mile, without experiencing cardiac symptoms like chest pain or shortness of breath. This approach ensures safety while promoting a return to a normal quality of life. Question 11. patient with an acute MI has an order for a continuous intravenous infusion of unfractionated heparin. The nurse should monitor which laboratory value to assess the effectiveness of the heparin therapy? A. Prothrombin time, PT. B. International Normalized Ratio, INR. C. Activated partial thromboplastin time, APTT. D. Platelet count. Answer, C. Activated partial thromboplastin time, APTT. This question evaluates your understanding of monitoring anticoagulant therapy, specifically unfractionated heparin. The keyword unfractionated heparin is the key clue. The activated partial thromboplastin time, APTT, is the standard laboratory test used to monitor the therapeutic effect of intravenous unfractionated heparin. An elevated APTT indicates that the heparin is achieving its desired anticoagulant effect, preventing further clot formation in the setting of an acute MI. Monitoring the APTT allows for dose adjustments to maintain the desired therapeutic range, balancing efficacy with bleeding risk. Question 12. A patient experiences sudden, severe, tearing chest pain radiating to the back, shortly after an MI. The nurse notes muffled heart sounds and pulses paradoxis. These findings are most suggestive of which complication? A. Recurrent myocardial infarction. B. Pulmonary embolism. C. Aortic dissection. D. Cardiac tamponade. Answer, D. Cardiac tamponade. This question tests your ability to identify the classic signs of cardiac tamponade, a serious complication that can occur after an MI, particularly if there's a ventricular wall rupture. The key clues are sudden, severe, tearing chest pain radiating to the back. Though this specific pain quality is more classic for dissection, the combination with the other findings is critical: muffled heart sounds, and pulsus paradoxis, a drop in systolic blood pressure with inspiration. These three signs form Beck's triad: muffled heart sounds, jugular venous distension, hypotension, which, along with pulsus paradoxis, strongly indicates fluid accumulation in the pericardial sac compressing the heart. Prompt recognition and pericardiocentesis are life-saving. Question 13. A patient with an acute MI develops ventricular fibrillation. What is the nurse's immediate priority action? A. Administer intravenous amiodarone. B. Initiate chest compressions and prepare for defibrillation. C. Administer intravenous atropine. D. Obtain a 12-lead ECG. Answer, B. Initiate chest compressions and prepare for defibrillation. This question assesses your knowledge of managing a life-threatening cardiac arrhythmia like ventricular fibrillation, VF. The keyword ventricular fibrillation signifies a chaotic, non-perfusing rhythm requiring immediate intervention. Defibrillation is the definitive treatment for VF, as it delivers an electrical shock to reset the heart's electrical activity. Prior to defibrillation, high-quality chest compressions must be initiated immediately to maintain some blood flow to vital organs until the defibrillator is ready. Delaying defibrillation significantly reduces the chances of survival, making this the absolute immediate priority. Question 14. When educating a patient recovering from an MI about symptoms of recurrent ischemia, the nurse should emphasize that chest pain may present atypically in which patient population? A. Young adult males. B. Postmenopausal women. C. Athletes. D. Individuals with a history of anxiety. Answer, B. Postmenopausal women. This question highlights the importance of recognizing atypical symptoms of myocardial ischemia in specific patient populations. The keyword atypically points to variations in classic chest pain presentation. Postmenopausal women, as well as older adults and individuals with diabetes, often present with atypical symptoms of MI, such as fatigue, indigestion, jaw pain, or shortness of breath, without the classic crushing chest pain. This difference in presentation can delay diagnosis and treatment. Nurses must educate these patients to be vigilant for any new or unusual symptoms, as prompt medical attention is still critical. Question 15. A patient with an anterior MI is receiving intravenous nitroglycerin. The nurse should closely monitor for which adverse effect? A. Hypertension. B. Tachycardia. C. Hyperglycemia. D. Bradycardia. Answer B. Tachycardia. This question evaluates your understanding of the adverse effects of intravenous nitroglycerin, commonly used in MI management. Nitroglycerin is a potent vasodilator, and while its primary goal is to reduce preload and afterload to decrease myocardial oxygen demand, this vasodilation can cause a reflex tachycardia. The body attempts to compensate for the drop in blood pressure by increasing heart rate. Excessive tachycardia can be detrimental in an MI patient as it increases myocardial oxygen demand, potentially worsening ischemia. Therefore, careful monitoring of heart rate and blood pressure is crucial during nitroglycerin infusion. Question 16. A patient is being discharged after an MI with a prescription for clopidogrel. The nurse should instruct the patient to report which symptom immediately? A. Mild headache. B. Occasional dizziness. C. Black, tarry stools. D. Muscle aches. Answer C. Black, tarry stools. This question focuses on critical patient education regarding antiplatelet medications like clopidogrel, commonly prescribed post-MI. Clopidogrel is an antiplatelet agent that works to prevent blood clots, but its main adverse effect is an increased risk of bleeding. Black, tarry stools are a classic sign of gastrointestinal bleeding, which is a serious complication requiring immediate medical attention. While mild headaches or dizziness might occur, severe bleeding symptoms like melena, black, tarry stools, indicate a significant internal bleed and must be reported immediately to prevent severe consequences. Question 17. A patient in the CCU following an extensive MI develops crackles in the lungs, elevated jugular venous distension, JVD, and peripheral edema. The nurse recognizes these findings as indicative of A. Pericarditis. B. Right ventricular failure. C. Left ventricular failure. D. Hypovolemia. Answer C. Left ventricular failure. This question tests the recognition of classic signs and symptoms of left ventricular failure, a common and serious complication post-MI. An extensive MI, especially in the anterior wall, can significantly impair the left ventricle's pumping ability. The keywords crackles in the lungs and elevated jugular venous distension, JVD, along with peripheral edema point to fluid overload resulting from the heart's inability to effectively pump blood forward. When the left ventricle fails, blood backs up into the pulmonary circulation, causing crackles. While JVD and peripheral edema can be associated with right heart failure, the presence of pulmonary crackles strongly suggests a primary left ventricular issue leading to fluid congestion. Question 18. A patient experiences chest pain at rest that is relieved by nitroglycerin, but their cardiac enzymes remain normal. The ECG shows transient ST segment elevation during the pain episode. These findings are most consistent with A. Stable angina. B. Unstable angina. C. Prinzmetal's variant angina. D. Non-ST elevation myocardial infarction, STEMI. Answer, C. Prinzmetal's variant angina. This question requires distinguishing different types of angina based on specific clinical and ECG findings. The key clues are chest pain at rest, relieved by nitroglycerin, normal cardiac enzymes, and transient ST segment elevation during the pain episode. Prinzmetal's angina, also known as variant angina, is characterized by coronary artery spasm, leading to temporary myocardial ischemia. This spasm often causes chest pain at rest and can produce transient ST segment elevation on the ECG, but importantly, without evidence of myocardial necrosis, normal cardiac enzymes. Unlike an MI, the ischemia is reversible with the spasm's resolution. Question 19. A patient is undergoing thrombolytic therapy for an acute STEMI. The nurse should immediately report which finding to the healthcare provider? A. Mild oozing from the foresite. B. Pink-tinged urine. C. A decrease in blood pressure from 130/80 to 110/70 mmHg. D. New onset of a severe headache. Answer, D. New onset of a severe headache. This question addresses a critical aspect of monitoring patients receiving thrombolytic therapy for MI, focusing on severe complications. Thrombolytic agents dissolve clots, but a major risk is uncontrolled bleeding, especially intracranial hemorrhage. A new onset of a severe headache is a classic and ominous sign of intracranial bleeding, which is a life-threatening complication of thrombolytic therapy. While some minor bleeding, like mild oozing, can be expected, a severe headache demands immediate assessment to rule out brain hemorrhage. Prompt recognition and intervention can be life-saving. Question 20. A patient post-MI is participating in cardiac rehabilitation. The nurse emphasizes the importance of a progressive exercise program. What is the primary goal of cardiac rehabilitation for MI patients? A. To completely reverse existing coronary artery disease. B. To prevent the need for future cardiac medications. C. To improve functional capacity, reduce risk factors, and enhance quality of life. D. To encourage competitive athletic activities. Answer, C. To improve functional capacity, reduce risk factors, and enhance quality of life. This question focuses on the purpose and benefits of cardiac rehabilitation following an MI. The primary goal of cardiac rehabilitation is a comprehensive approach to recovery and secondary prevention. It aims to improve the heart's functional capacity through supervised exercise, educate patients on modifying cardiovascular risk factors, like diet, smoking cessation, stress management, and ultimately enhance their overall quality of life and psychological well-being. It is not about reversing existing disease or eliminating medications, but rather optimizing health and preventing future events. Question 21. A nurse is assessing a patient with a suspected inferior wall MI. Which lead abnormalities on a 12-lead ECG would confirm this suspicion? A. ST elevation in leads V1, V4. B. ST elevation in leads I, AVL, V5, V6. C. ST elevation in leads 2, 3, AVF. D. ST elevation in leads V3R, V4R. Answer, C. ST elevation in leads 2, 3, AVF. This question tests your ability to correlate ECG lead changes with the specific anatomical location of a myocardial infarction. The keywords inferior wall MI directly point to the leads that reflect this area of the heart. The inferior wall is best viewed by leads 2, 3, and AVF. Therefore, ST segment elevation in these leads confirms an inferior wall MI. Understanding lead placement and the areas of the heart they represent is fundamental for accurate MI diagnosis and subsequent management. Question 22. Which finding would be most concerning for a nurse assessing a patient with an acute MI, indicating potential cardiogenic shock? A. Mild hypotension, BP 100/60 mmHg, with warm, dry skin. B. Persistent chest pain despite nitroglycerin. C. Clear lung sounds with a normal respiratory rate. D. Systolic blood pressure of 80 mm of mercury with cool, clammy skin and decreased urine output. Answer: D. Systolic blood pressure of 80 mm of mercury with cool, clammy skin and decreased urine output. This question directly assesses the ability to identify critical signs of cardiogenic shock, a severe complication of MI. Cardiogenic shock is characterized by the heart's inability to pump enough blood to meet the body's demands, leading to widespread hypoperfusion. The key clues are systolic blood pressure of 80 mm of mercury, significant hypotension, cool, clammy skin, due to vasoconstriction to shunt blood to vital organs, and decreased urine output, indicating poor renal perfusion. These findings collectively signify severe circulatory compromise and impending organ failure, requiring immediate and aggressive intervention. Question 23. A patient is experiencing chest pain suspected to be an MI. Besides an ECG, what is the most crucial initial diagnostic test that should be ordered? A. Chest X-ray. B. Complete blood count, CBC. C. Cardiac enzyme levels, troponin. D. Arterial blood gas, ABG. Answer: C. Cardiac enzyme levels, troponin. This question focuses on the immediate diagnostic workup for a suspected MI. While an ECG is vital for identifying ST elevation, cardiac enzyme levels, particularly troponin, are the most crucial laboratory test to confirm myocardial damage. Troponin is highly specific to cardiac muscle injury and its elevation signifies myocardial necrosis, even in the absence of definitive ECG changes. Therefore, troponin levels, in conjunction with the ECG and clinical presentation, form the diagnostic triad for myocardial infarction. Question 24. A nurse is administering a loop diuretic, e.g., furosemide, to a patient with acute decompensated heart failure following an MI. The nurse should prioritize monitoring which electrolyte? A. Sodium. B. Calcium. C. Potassium. D. Phosphate. Answer: C. Potassium. This question addresses the important nursing considerations when administering loop diuretics in the context of heart failure post-MI. Loop diuretics, such as furosemide, are potent diuretics that work by inhibiting reabsorption in the loop of Henle, leading to increased excretion of water, sodium, and most importantly, potassium. Hypokalemia, low potassium, is a common and serious side effect of loop diuretics, which can predispose cardiac patients to dangerous arrhythmias. Therefore, closely monitoring serum potassium levels is essential to prevent adverse cardiac events. Question 25. What is the primary purpose of administering aspirin to a patient experiencing an acute myocardial infarction? A. To relieve chest pain. B. To reduce platelet aggregation and prevent clot extension. C. To lower blood pressure. D. To improve oxygenation. Answer: B. To reduce platelet aggregation and prevent clot extension. This question tests your knowledge of the fundamental role of aspirin in the acute management of myocardial infarction. Aspirin is an antiplatelet agent that works by irreversibly inhibiting cyclooxygenase, which in turn reduces the production of thromboxane A2, a potent platelet aggregator. In an acute MI, its primary purpose is to quickly inhibit platelet function, thereby reducing the formation of new clots and preventing the existing clot in the coronary artery from growing larger. This helps to maintain or re-establish blood flow and minimize myocardial damage. Remember, aspirin is a critical initial intervention for its antiplatelet effects, not primarily for pain relief or blood pressure.